Coming to you from Health in Las Vegas, I'm Kristina Ayanian with Nasdaq. And joining me is co-founder and CEO of BrightInsight, Kal Patel. Kal, thank you for joining us. Great to see you.
Thanks for having me, Kristina. Nice to see you as well.
Let's start broad. Talk to me about BrightInsight and the company's mission.
Yeah, BrightInsight's about leveraging digital to help improve the real-world outcomes for patients. And the way we do that is, we think about any industry, but we're focused with pharmaceutical companies. You have to create a great product, you have to get users for your product, then you have to keep users on your product, right? And so for healthcare and pharmaceuticals, that's particularly important. And where we come is really help them with that third bucket. Once you've gotten on your medicine, how do you support the patient with digital solutions that keep them engaged, that support them in taking their medicine, things like adherence reminders, help them track how their disease is progressing so they can see the progress they're making, or if they're not making enough progress, how do they have the data to go back to their clinician to make adjustments? So we're building digital solutions that really wrap around drugs to help do that, to get that patient to a better clinical outcome.
That's amazing. It really sounds like you're acting as a partner in that patient's life.
Exactly. Yeah, we play a really important role for our pharmaceutical clients and the patients, because what we're really helping them do is to take what is often a very complex disease that can be very difficult to manage with these very innovative and expensive medicines, but help them really relate and stay with that therapy so they can integrate that into their daily lives.
And it also seems like the company is evolving as the times are evolving and as patient needs evolve. You've had new customer program launches. What pain points are they addressing?
Yeah, maybe just to highlight a few launches for our customers this year. We've covered really a broad segment of diseases. So we had a launch in the atopic dermatitis space, which is a disease that affects many millions of patients, and now there's more and more effective therapies coming. And what we're doing in that case is really helping the patient onboard to the therapy. How do I learn how to inject myself? Because in this case, they're often injecting themselves with the medication for the first time in their lives to take a therapy with that kind of injection modality. We're doing things like, as I mentioned earlier, helping them think about how to track the progress of the intervention and how it's working for them. We're helping do personalized adherence reminders, so things like that in that case. So that's one example. We have another launch that we did in a very different therapeutic area in macular degeneration, so a very different population. It's generally an older population. And for these patients, they're literally going to go blind over time without this innovative therapy from our customer, another different top 10 biopharma company. And they get these injectables into their eyes. And what's important is to get continuous assessment, because they will need retreatment. What we don't know is a particular patient doesn't know when they're going to need that retreatment. So today they have to go into their ophthalmologist on a regular basis. But what we've done is launch an at-home vision test that lets them, at the comfort of their phones and their own homes, check their vision every week or two. And that data goes back to their ophthalmologist, and the algorithm determines if they're having a deviation, and if they are, then they can go back in for reassessment and retreatment. So it's a really big win for the ophthalmologist, gives them the comfort that the patient's being monitored, and when they have an issue, they can be brought in. It's huge benefit for the patient, because they also aren't worried, is my vision worsening and I don't know about it? Or and they get the convenience, and the caregiver gets the convenience of not having to take time off and take them in on a regular basis. They can do that all at the convenience of home from an app. And then we did an ultra-rare disease launch where it's a very difficult disease that is genetically based. And what the app does there is it supports the patient in this very complex dosing regimen. So when you start the therapy, first ever of its kind approved by the FDA, you have to get pretty regular blood tests until you get to the right dose. And what we're able to do is help support that patient to monitor and track how they're progressing, and support the clinician and the caregiver around that to help them get to that successful treatment dose. So those are the types of examples of recent launches we're doing. We're really excited about it. As you can see, very different disease areas. These are populations that are often have quite a lot of disability that we're helping, and we're doing it not just in the U.S., but in many cases, many countries around the world.
That's amazing. It really sounds like you offer that holistic end-to-end solution. How does your disease management solution really disrupt the marketplace?
Yeah, so what we're really doing for the first time is helping transition where the care is largely driven by humans that are in a call center, or relying on the patient or the caregiver to go to the internet or get information where they can. And instead what we're doing is giving a digital first approach to engaging the patient, providing and the caregiver, and providing them the right kind of data or actionable assistance they need in a personalized way, kind of at the right time in the right channel. So it's just a very different way to think about it. And for us, that's really a breakthrough in how we're beginning to work with pharmaceutical companies. We're really moving into that, what we're calling a digital first patient support program.
Yeah, let's talk about that digital first solution program. What are some of the new products and offerings?
Yeah, so what that fundamentally does is say, hey, instead of relying again on that kind of human call center approach, most of us in most of our lives, when we're looking for information, when we're looking for support, we usually start in a digital oriented way, right? And in our, not just belief, but our experience now shows that when you build a really great digital solution that addresses the needs of the user and you allow personalization around that, most people will get the benefit they're looking for, the support they need through the digital experience. However, depending on your situation or if a certain challenge comes along, you want to be able to get the call center, then you can do that. And so we kind of bring all that together in an integrated fashion. The example I like to give is I live in the Bay Area, so I travel a lot for work and for fun, and so I'm a United 1K member. And so they have a great call center. But 90+% of the things I do is in the United app, because the app gives me all the functionalities I need in a very user-friendly way. And I can do what I need to do or get the support I need there. But if I need to talk to a human, I know they're there. It's the same kind of thing here. So instead of starting with the call center, we say start with a great digital experience, meet people where they want to be met, and then back them up with the human support if needed.
You have the digital, but then you also have the human element to it as well. So it's acting as a tool rather than a replacement.
Exactly. Yes, it's enhancing the experience for the patient, while at the same time giving them the full support that they may need that only a trained human can provide.
That's amazing. Well, Kal, we wish you much continued success. Thank you so much for sharing your story and joining us.
Thanks for having me.